Hello, beautiful people. It's Steffi B, and I'm here to study with you guys. Today's topic is pediatric nursing. We're going to do 10 questions. We're going to go over the answers. If you need more time, hit the pause button. And guys, I'm pretty excited to wear my t-shirt again. Been there, done that, got the t-shirt. And guys, I want the same thing for you guys, all right? So let's go ahead and let's get started. Number 1. Which nursing actions apply to the care of a child who is having a seizure? Select all that apply. 1. Time the seizure. 2. Restrain the child. 3. Stay with the child. 4. Insert an oral airway. 5. Loosen clothing around the child's neck. 6. Place the child in a lateral sideline position. The answer here is number 1, time the seizure. 3, stay with the child. 5, loosen clothing around the child's neck. And 6, place the child in a lateral sideline position. Why are those the answers? Let's go back to the question and let's see what it's asking us. So it's asking us, which nursing actions would we take if we see a child having a seizure? Select all that apply. Our favorite types of questions. So the best way to approach this type of question is by saying yes or no. Yes, this is true. No, it's not. So first one, time the seizure. Do we want to time the seizure if we see a child having a seizure? Is that important information that we need to know? Yes, it is, because if a child is having a seizure more than 5 minutes, or if the child is having more than one seizure in 5 minutes, that is a medical emergency, which is status epilepticus, and it can lead to brain damage or death, and that is something that we do not want, right? So, time the seizure. Number 2, restrain the child. If they're having a seizure, do we want to hold them down? Is that going to help them? No, that might actually cause injury and harm, so we do not want to do that. Number 3, stay with the child. Yes, if we see a child having a seizure, do we want to walk away? I don't think that's the safest thing for the child, right? We want to monitor them, observe the environment, right? Make sure it's safe. 4, insert an oral airway. If they're having a seizure, do we want to be putting something in their mouth? No. Right? Because we can cause injury to their mouth, their gums, their teeth. We don't want to do that. 5, loosen clothing around the child's neck. Yes. Right? We don't want them to choke. We want to loosen it up. 6, place the child in a lateral sideline position. Yeah, we want to put them on their side, right? Because if they do vomit, we want them to vomit while they're laying sideways. If they're sitting on their back and they vomit, they might aspirate, right? So we want to put them on their side. All right, moving on. Number 2. The nurse has provided instructions to the parent of a child with sickle cell disease regarding measures that will prevent sickle cell crisis. Which statement by the parent indicates an understanding of this measures? 1, my child needs to avoid any exercise. 2, my child needs to avoid increasing any fluid intake. 3, my child needs to avoid going outdoors in warm weather. Or 4, my child needs to avoid situations that may lead to an infection. So the answer here is number 4. My child needs to avoid situations that may lead to an infection. So why is that the answer? Let's go to the question and let's see what they're asking us. They're asking us, so which statement shows that the parent understands sickle cell disease, right? And how to prevent a sickle cell crisis. To understand sickle cell disease, we need to understand what's normal, right? To understand what's abnormal. So if we look at a red blood cell and the normal shape, it's a disc shape, right? It's like a circle. So it is usually flexible, right? Going through the blood vessels, so it's moving, right? It's doing its thing and it's flowing. Somebody who has sickle cell disease, their cell is like a sickle cell shape. So it's like a C for cell. So their chances of getting stuck in the vessel are a lot higher because this cell is not flexible. So it can like get stuck in the vessel, right? So it can stop blood flow, and then it will show, this will be a lack of oxygen, and then this will cause pain. We do not want that, right? So let's look at the answers. Number 1, my child needs to avoid exercise. No, this child can exercise, right? But they need to stay hydrated, right? That's important. They do not want to be dehydrated. So with exercise, they don't want to be running a 15K in Florida, where I am, where it's really hot, and not drink any water and be super dehydrated, and you have sickle cell disease. Why? Well, if you're dehydrated, your blood vessels will not be vasodilated. They will be vasoconstricted. So they will be a lot narrower. So your chances of your sickle cells to get stuck are a lot higher. So we want you to stay hydrated. So number 2, my child needs to avoid increasing fluid intake. No, we want you to increase it. We want you to drink those fluids, right? Dilate those vessels, right? So your sickle cells can be like swimming in there, right? So they don't get stuck. Number 3, my child needs to avoid going outdoors in warm weather. What happens to your vessels in warm weather? Does it vasodilate or does it vasoconstrict? It vasodilates, right? So go ahead, enjoy the warm weather. That's good for you. What we want you to do is avoid cold weather, right? Because if you're in cold weather, your vessels will constrict, right? So the chances of your sickle cell getting stuck are a lot higher. Number 4, my child needs to avoid situations that will lead to an infection. Yes, because an infection can lead to dehydration that can lead to a sickle cell crisis. Because when you have an infection and you're sick, you are less likely to eat or drink, so that you're at a higher risk for being dehydrated, and we do not want that, right? All right, moving on. Number 3, the clinic nurse reviews the record of a child just seen by a primary healthcare provider and diagnosed with suspected aortic stenosis. The nurse expects to note documentation of which clinical manifestation specifically found in this disorder. 1, pallor, 2, hyperactivity, 3, exercise intolerance, or 4, gastrointestinal disturbances. Answer here is number 3, exercise intolerance. Why? Let's go to the question. What are they asking us? They're asking us, what clinical manifestations would we see in a child who has suspected aortic stenosis? What is aortic stenosis? That is when your valve is narrowed, right? So your valve is not open fully, right? So you have reduced blood flow. So it's resistant, right? So you're gonna have reduced cardiac output. All that blood is gonna be flowing back to your left ventricle. It's not gonna be going all out to your body. So your left ventricle, those walls are gonna be thickening, right? So you're gonna have left ventricle hypertrophy, right? And then it can back up even more, go through your mitral valve, go to your left atrium, go through your pulmonary vein, go to your lungs, and it can cause pulmonary vascular congestion. We don't want that, no, right? And then, so if you have aortic stenosis and your valve is narrow, right? Your heart has to work, right? It's trying to pump blood. It's trying to push that blood out to your body, right? So it has reduced blood flow, reduced oxygen, right? So it can cause chest pain. It can cause you to be fatigued and weak. So 1, you may or may not have pallor, right? Because if you have reduced blood flow going to your upper and lower extremities, you want to check that capillary refill, those pulses, right? But you want to look at that skin too, is it going to be pale? Like look at your skin color. Look at that circulatory system. And then 2 and 4 are unrelated to the disease. Number 4. A primary healthcare provider has prescribed oxygen as needed for an infant with heart failure. In which situation would the nurse administer the oxygen to the infant? 1, during sleep, 2, when changing the infant's diaper, 3, when the parent is holding the infant, or 4, when drawing blood for electrolyte level testing. Here, the answer is number 4. When drawing blood for electrolyte level testing. So why is that the answer? Let's go to the question. What are they asking us? They're asking us, what situation would we give oxygen to an infant that has heart failure? So let's look at the options. So right away, we should think that we're looking for a situation that's stressful, right? Or invasive, right? So if there's a stressful, invasive time, this infant is going to require energy, that requires oxygen, right? Because if this infant is stressed, what is that infant gonna do? It's gonna cry, right? So it's gonna exhaust the infant, right? So that infant is gonna need energy, and that energy requires oxygen. Number 1, during sleep. Is that stressful? No, that sounds pretty peaceful. Number 2, when changing the infant's diaper. Might be stressful, but there's another answer here that's a better answer. Number 3, when the parent is holding the infant. That's actually soothing for the infant. Number 4, when drawing blood for the electrolyte level testing. Yes, the infant will be crying. So that is gonna make the heart work, right? Because if the infant is crying, it's going to be demanding energy. So that's going to be a lot of work on the heart. The heart is going to require oxygen. So you want to give that infant oxygen. Number 5, the nurse is monitoring an infant with heart failure. Which sign alerts the nurse to suspect fluid accumulation and the need to call the primary healthcare provider? 1, bradypnea. 2, diaphoresis, 3, decreased blood pressure, or 4, a weight gain of 1 pound in 1 day. And the answer here is number 4, a weight gain of 1 pound in 1 day. Why is that the answer? Let's look at the question. What are they asking us? They're asking us which sign alerts the nurse to suspect fluid accumulation. So let's look at the options. Number 4 should stick out, right? A weight gain of 1 pound in 1 day, right? Because if we gain weight, we're holding on to fluid, right? There's a fluid accumulation. With heart failure, when you think of heart failure, think of fluid, right? Because with heart failure, you have the inability to pump oxygen to your body, right? Your heart is not working right? It might be weak, right? It's just not working right. If it's not pumping right, you'll see edema, right? So we want to check urinary output, right? We want to see what's coming out. We want to check for facial edema. We want to look for edema in our peripherals, upper extremities, lower extremities, right? We want to auscultate lung sounds. We want to listen for crackles. We want to hear if there's fluid in the lungs. Okay, let's look at the options. Number 1, we would hear tachypnea. They would be breathing fast, right? If they have a lot of fluid, right, their body's going to be working. Number 2, diaphoresis. Diaphoresis is not a sign of heart failure. Number 3, they would have increased blood pressure. And number 4, they would have a weight gain of 1 pound in 1 day. Number 6, the nurse is creating a plan of care for a child admitted with the diagnosis of Kawasaki disease. In developing the initial plan of care, the nurse would include monitoring the child for signs of which condition? 1, bleeding, 2, heart failure, 3, failure to thrive, or 4, decreased tolerance to stimulation. And the answer here is number 2, heart failure. So why is that the answer? Let's go to the question. Let's see what they're asking us. They're asking us, what would we monitor in a child that has Kawasaki disease? What is Kawasaki disease? Kawasaki disease is when your immune system attacks your blood vessels, right? Specifically your coronary arteries around your heart. So this is a rare disease, right? The cause is unknown, but we think it's related to either infection or a genetic predisposition of the disease. So with this disease, we want to look at cardiac issues, right? Kawasaki, cardiac issues, right? So we might see an aneurysm, which is bulging of your blood vessel, right? Like it's like a little sac sticking out of the blood vessel, right? We might see heart failure, number 2. So if somebody has heart failure, what would we see in that child? We would see high respiration rate. We would see a high heart rate. They might have dyspnea, right? Because they're breathing fast, their heart rate's going up, right? Because their body's working, because they're having trouble breathing, because they might have crackles, right? Fluid in their lungs, because they're gonna have fluid buildup, right? Remember, heart failure, fluid. Because if your heart isn't working properly and it's not pumping properly, you're gonna have fluid buildup somewhere. So you might have edema, upper extremities, lower extremities, facial edema, abdominal distension, right? So those are things that we want to look for. And then if we look at the other 3 options, those are not conditions directly associated with this disease. All right, moving on. Number 7. The nurse in the healthcare clinic receives a telephone call from a parent of a child who reports that an insect has somehow flown into the child's ear. The parent reports that the child is complaining of a buzzing sound in the ear. Which priority instruction would the nurse provide to the parent? 1. Report to the clinic immediately. 2. Irrigate the ear with diluted alcohol. 3. Use tweezers to try to remove the insect. Or 4. Use a flashlight to coax the insect out of the ear. The answer is number 4. Use a flashlight to coax the insect out of the ear. Why is that the correct answer? Let's go to the question and see what they're asking us. So they're asking us, which priority instruction would we do as a nurse to provide a parent instructions to remove this insect out of the child's ear? So we want to start with the most non-invasive intervention first, and then get a little more invasive, right, if it doesn't work. So the first thing we would do is either try a flashlight or a humming sound to remove the insect. So number 4 is correct. If that doesn't work, then we would tell them to come into the clinic, right? They would come into the clinic and we would want to kill the insect first before removing it. We would do that by either using diluted alcohol or mineral oil. Once the insect is killed, then we would remove it with a forceps. We do not want them sticking tweezers in their ear trying to get it out. So that's why we want to start with the flashlight. If that doesn't work, we want them to come into the clinic and we'll take care of it. They don't have to worry about it. All right, moving on. Number 8. A parent arrives at a well baby clinic with a 1-month-old infant. The parent expresses concern because one of the infant's eyes appears to be crossed. What is the nurse's best response? 1, the infant will probably need surgery. 2, this condition is probably permanent. 3, it requires monitoring because the other eye may do the same thing. Or 4, this is normal in the young infant but would not be present after the age of about 4 months. The answer here is number 4. This is normal in a young infant but would not be present after the age of about 4 months. So why is that the correct answer? Let's go to the question, what are they asking us? So they're asking us, what is the nurse's best response to a parent that has an infant that's 1 month old and appears cross-eyed? So in this question, they mentioned there's an infant and the infant is 1 month old, right? So just remember, if an infant is under 4 months old, it is normal for their eyes to appear cross-eyed, right? That is okay. So number 4 is the correct answer. It's called strabismus, right? So their eye muscles are weak, right? So when they start to use their eyes more, it'll strengthen the muscles and it'll correct the alignment, right? So before 4 months, that's not concerning. If it's after 4 months, then it's concerning. You want them to come back and we'll address their concern. So the other options are inappropriate responses, right, for a parent that has a 1-month-old. All right, moving on. Number 9. The nurse is providing home care instructions to the parent of a 9-year-old child diagnosed with bacterial conjunctivitis. Topical antimicrobial therapy is prescribed for this child. Which statement by the parent indicates that the teaching has been effective? 1. My child cannot return to school until seen by the pediatrician in 1 month. 2. My child can return to school immediately because my child is not contagious. 3. My child needs to stay home from school for at least 3 weeks to complete the entire prescription of eye drops. Or 4. My child will need to stay home from school until my child has received the eye medication for at least 24 to 48 hours. And the answer here is number 4. My child will need to stay home from school until my child has received the eye medication for at least 24 to 48 hours. So why is that the correct answer? Let's go to the question and let's see what it's asking us. So it's asking us which statement shows that this teaching was effective, right? So this parent has a 9-year-old child that's diagnosed with bacterial conjunctivitis and is on a topical antimicrobial therapy. So with bacterial conjunctivitis, it is extremely contagious, right? So this child cannot be at school, cannot be at daycare, cannot be around other people until he is on a medication for at least 24 to 48 hours, right? Once this child is on this medication for 24 to 48 hours, this child can be seen by a pediatrician. This child will no longer be contagious after 24 to 48 hours. And this child can go back to school after 24 to 48 hours. Number 10, last question. The clinic nurse is assessing jaundice in a child with hepatitis. Which anatomical area would provide the best data regarding the presence of jaundice? 1. The nail beds. 2. The skin in the sacral area. 3. The skin in the abdominal area. Or 4. The membranes in the ear canal. The answer here is number 1, nail beds. So why is that the answer? Let's go to the question. What are we looking for? So we're looking for an area that will give us the best data for jaundice. So with jaundice, the best areas to look are the nail beds, number 1, the sclera around your eyes, right? And mucous membranes, like your oral mucosa. So those are the best areas to assess for jaundice. Okay, don't forget that. Okay, so it makes the other options not options. All right, guys, we are all done. Good job, guys. Thank you guys for studying with me and investing in yourselves and in your future. I know that sounds super corny, but it's super true. And guys, if you have comments, questions, if you want me to do a certain topic, just leave it down below. If you guys like the video, if you can like it, so I have a heads up to see if I should keep making videos like this. But guys, keep staying focused, keep studying, keep doing your thing, and I will see you guys soon. All right, bye, beautiful people.